women will come and say now, no, they again wait. Why on the real sense that they are not feeding the baby well? Some of them they will come and say that the baby is sleeping. Even if the baby is sleeping, wake up the baby in every 2 hours or highest 3 hours. 2 hours is okay. Even with that sleeping child, it's I don't know, he will start sucking. But some of them will not do anything, say the baby is sleeping. The baby is just closing his eye because he's used to the environment where he always closes the eye. Man, if you don't give the baby food for after 6 hours, the next time the baby will bring the baby here and other add weight. How can the baby add weight? Where will he add weight? I don't even understand. Those days in my primary school, they were asking one boy, say, what will you be when you grow up? The boy, when I get, I said, what will you be when you grow up? Or some person when they chop, they grow. So if the person no chop, how he go grow? So you are still talking about what you will be when you will grow up. When the child is already, the boy is already sure he is not going to grow because he don't used to chop. So when you are not giving the baby any food, and you come here and tell me that the baby is not adding weight, nature they got now. How can the baby grow when the baby is not eating? Also, can I cause jaundice? Okay, that will be the last question. Jaundice usually is 2 types. Okay, we have what we call physiological jaundice, we have pathological jaundice, as in that is normal jaundice and abnormal jaundice. Okay, whenever the jaundice occur in the child after 3 days of delivery, it is likely to be physiological jaundice. And what causes that jaundice is destruction of blood. So by the time the baby comes out, the blood level of the baby can be as much as 18 grams. Why what the baby needs to survive is about 14 grams. He doesn't need the other 4 grams. I don't know if you understand. So the other extra 4 grams will have to be destroyed to give way. And whenever that happens, the 4 grams that was destroyed has to be excreted by the liver. Still again, since the liver is not fully mature, some of them will remain in the blood. But once it is not too much, the treatment for that is just phototherapy. Or a special phototherapy machine. Initially, we used to give phenobab, but this time we no longer give phenobab. This is a physiological jaundice. Even without much treatment, is going to be taken care of. I don't know if you understand. But unless that we just deliver the baby now, if not intrauterine infection, that is infection the child when born on alpha. If he's dead, the child can have jaundice from the time of delivery. That's the time, the one we need to start treating immediately. But those ones that occur usually after 3 days or 4 days of delivery, most time those ones are physiological jaundice. Anyway, before we now coin that word and dismiss other things, we usually do some tests. Serum bilirubin. That serum bilirubin will tell us what level of jaundice do we have. Is it the one? But highest we talk about exchange blood transfusion. But most of the serum that people use has not been shown to be effective. The best one is phototherapy. Thank you. Now, malaria can cause it, but I say that one is intrauterine infection. But if the jaundice occur in a big adult, malaria can be a cause.